Hello friends, welcome to Physiodemic. In this video I will tell you about the text neck syndrome, which is a very common problem among the people nowadays. So let's begin. So this text neck syndrome refers to repetitive stress injury from looking down at your handheld device for a long period of time, and this term was coined by a US chiropractor, Dr. Dean L. Fishman. And this text neck, which can potentially affect the millions around the world and is a growing health concern among the peoples nowadays. So it is also known as a turtle neck postures and anterior head syndrome. So now I'll tell you about the clinical presentation of the text neck. Okay, so flexing the head forward to use your smartphone or any handheld gadgets directly affect your cervical spine and neck. Okay, so tilting the head forward for around 15-degree places about 27 pounds of force on your neck, and similarly if it is tilted around 30 degrees, then it puts around 40 pounds of force on your neck. 45 degree of tilting puts force around 49 pounds force on neck, and 60 degree tilting puts around 60 degree of force on your neck. So the most common presentation are neck pain, stiffness, and soreness of the muscles around the neck. So the patients complain soreness and difficulty in moving after using a handheld device for a long period of time, and also the patients complain dull-looking pain over the localized and diffuse area over the lower neck. Okay, sometimes patients complain radiating pain to the shoulder and often complain shoulder muscles weakness like upper trapezius, rhomboids, and shoulder external rotators. And few of the patients also complain tension type of headache. And in addition to the above this, there can also be means you can also found with the patients like flattening of the thoracic kyphosis, early onsets of arthritis, spinal degeneration, and disc compressions. So I will tell you about the treatment of the text neck. So prevention is the key when it comes to the treatment of the text neck. Okay, so whenever a patient goes to a doctor for the treatment of the text neck, the doctor prescribes non-steroidal anti-inflammatory drugs and analgesic to reduce the inflammations and pain. Okay, and with the same time also, and doctors also give some advice to the patient, and these advice are avoid excessive uses of any handheld device and take frequent breaks. Okay, and avoid prolonged static postures, and also position the device such that reduces less stress on your neck and upper extremity, and also avoid prolonged typing and sweeping actions. Okay, so these are the general recommendations given by doctors to a patient. Okay, for the treatment of the text neck syndromes. Now I'll tell you about the physiotherapy treatment of the text neck syndrome. So whenever a patients come to a therapist for the treatment of the text neck syndrome, the therapist take a proper and thorough examinations of the patient, and as per the examination finding, the therapist plan a treatment protocol. So in this protocol, the first technique is the soft tissue mobilization technique. In soft tissue mobilization technique, different methods are used like trigger point release, ischemic compression, sustained myofascial tension techniques are used. Okay, to reduce the muscle spasm around the neck. The second technique is the mobilization technique of the spine, and in mobilization techniques, Maitland and Mulligan mobilization techniques are used by the therapist. And in Maitland techniques, the grade 1 and grade 2 mobilization techniques are very useful to reduce the pain and spasm, okay, around the neck. The third technique is the stretching of the muscles, the tight muscles around the neck, and the therapist teach how to stretch the tight muscles around the neck, and these tight muscles basically the stretching of the upper trapezius, levator scapulae, and the pectoralis muscle is taught to the patient. Also, the patient is asked to continue at home. The other techniques are like strengthening exercises. In strengthening exercises, as per the examination finding, the therapist teaches the strengthening exercise of the muscles around the neck, and the exercises are basically the isometric neck exercises taught to the patient, and sometimes patient has to do interscapular strengthening, interscapular muscle strengthening exercises also, and also the motor control exercises like deep neck flexor activations exercises are taught to the patient. So in addition to above all these things, okay, so this postural retraining technique is also taught to the patients, and how to maintain a proper aligned postures while working at home or at office. And with that, home exercise program is also taught to the patients to continue at home. Okay, but in case of chronic cases, the pain medications and the facing joint injections is recommended to the patients. So thanks for watching this video. Stay tuned to the Physiodemic for further new updates. Thank you.